Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everybody, and welcome to episode number 103 of the Better Health Guy blogcast series. Today's guest is Dr. Simon Yu, and the topic of the show is accidental blow-up in medicine. Dr. Simon Yu is a board-certified internist who founded Prevention and Healing Incorporated to offer integrative medicine to patients from St. Louis, across the nation, and around the world. His two books, Accidental Blow-Up in Medicine, Battle Plan for Your Life, and Accidental Cure, Extraordinary Medicine for Extraordinary Patients, give unique insights from his work at Prevention and Healing, learning Eastern, Western, and innovative medical technologies, and 25 years in the U.S. Army Reserve Medical Corps, from which he retired as a full colonel. Dr. Yu received his medical degree from the School of Medicine at the University of Missouri-Columbia and completed residency training at St. Mary's Health Center in St. Louis. He has a BS from Washington University and an MS through a Washington University Medical Center, University of Missouri-St. Louis joint program where he conducted research on immunology. He is a leader in detecting and treating dental, fungal, and parasite problems overlooked by conventional medicine. Dr. Yu lectures around the world and has studied biological medicine extensively in Europe. He organized 10 international integrative medicine conferences held in St. Louis. Dr. Yu trains physicians, dentists, and prescribing health professionals on Acupuncture Meridian Assessment, or AMA, an updated digitized method that provides forensic insights into problems underlying many chronic illnesses. AMA can be used to detect and monitor treatment of parasite and fungal problems, hidden dental infections, immune and toxicity reactions to dental and medical device metals and chemicals, and the growing epidemic of allergy immunology problems. And now my interview with Dr. Simon Yu. Parasites, fungi, and dental issues are three of the commonly overlooked factors that may hold people back from achieving optimal health. Unfortunately, conventional medicine often overlooks these important keys, but fortunately for us, we have Dr. Simon Yu, MD, today. Not only does MD stand for medical doctor, but in his case, medical detective. Using his acupuncture meridian assessment techniques, he's often able to find important clues that many others may have missed. Thanks for being here today, Dr. Yu.
Well, thank you for inviting me.
Talk to us about how you first got interested in parasites and how this interest emerged out of your work in the military and treating sick military personnel.
Yeah, I'm an internist and I do look for parasite, but I never find when I do soil test anything shows up significant. So I never thought parasite was anything significant in my practice in the United States, just like everybody else. I was in the military in the U.S. Army as a reservist for 25 years. In the year 2001, I was in Bolivia, just a short mission, 2-week training, treating people for Bolivian and the Indian natives. And we give everybody parasite medication. We are in Oruro. We go to a small town, people line up, we're the vet, we're the dentist, and we're the medical team. And medical team, we're giving out all those parasite medication every day for about 10,000 people. And we use either parental palm oil or mebendazole. They're the two least expensive parasite medication available that's dispensed by U.S. Army. And since then, I've been using parasite medication. So story goes like this. I was doing acupuncture meridian assessment before I went to 2001. I've been doing it for 25, 30 years. And if somebody have a IBS, intestinal problem, I check the meridian system showing in large intestine is out of balance. I put them on natural parasite remedies like wormwood, black walnut, clove oil, and patient gets happy. And when patient gets happy with the IBS symptom going away, and I'm happy. That was until 2001. When I came back from 2001 from Bolivia, I decided to try maybe parasite medication, how they respond. So I use parental palm oil or mebendazole, depends how they test. And the difference is that patient gets better with the IBS-like symptoms, but also they will say, oh, by the way, maybe it's a coincidence, but my asthma went away. Or by the way, my chronic fatigue, my fibromyalgia got better. I got a phone call from my patient saying she came for chronic fatigue, but she didn't tell me her main problem is actually MS. And says, my neurologist said, I don't have a MS anymore. I had an MRI done and there's normal brain lesions. For cancer patients, their condition become more stable. So all those phenomena, or migraine headache, I say all the time the migraine headache goes away. So this is what I'm sorry about. By the way, besides my IBS, there's so many other problems went away or spontaneously using parasite medications. That's how I got into parasite medication.
How much of your military background influences the way in which you practice medicine today?
Oh, I'm not sure about that because military medicine is basically same, no more different than any my internal medicine practice. My biggest difference is that my experience in Bolivia, when I was already doing meridian testing, and I connected that when I see this phenomenon of by the way, my asthma went away, my migraine headache went away, connected that maybe there's something to do with parasite and many unexplainable medical problems.
But how about the approach in terms of the military? I know on your book you say battle plan for your life. So do you view recovering from a chronic health challenge similar to a battle?
Actually, yes. My second book, the new book, talking about as a battle plan. That's right. Yeah. Now, I was in what we call a Command and Staff General College course at Fort Leavenworth. It's a 2-year program as a reservist, and I only complete 50% because I was busy getting called up. But anyway, I did not want to waste my military training, and I always want to use the analogy from the military training, looking for what I call asymmetric threat, the enemy that you don't know where they're at, what they're hiding. So I use this parasite, fungal, dental problem as a metaphor, as an asymmetric threat. So I was explaining that as so people can relate to as an unknown this threat that
Fantastic.
we overlook.
What are some of the main conditions that people seek you out to help them with? Do they come to you to solve a medical mystery, or do they come to you because they know that you have expertise in parasites and dental issues?
Whether I like it or not, I have a sort of a reputation for as a guy to look for parasite problem. I don't have any formal training in parasite. I just purely from experience from the military, and then applying that in different combinations, give a better successful outcome. Now, one thing I learned sort of a hard way is that it's hard to get rid of this parasite if you have a dental infections. I've been doing this DNA test, and often these people have also parasite in the dental as a cavitation, as periodontal problems. And so when you do DNA tests, often we'll see not only all those different microbes, but parasite as a protozoa, as an entamoeba, they go down to the gut, and it's very hard to break their cycle. So when I fail to treat my patient for parasite problem, they often have a dental problem that was not addressed yet.
Very interesting. What are your top strategies for addressing the root causes of disease, or what you call the hidden enemies?
I do Acupuncture Meridian Assessment. The Meridian system has been known for thousands of years. So I call it 5,000-year-old disruptive new technology. So old, it becomes so new. Now with the modern technology, we have an electronic device. Now we can measure meridian system more precisely.
And I know in the book you talk about your focus looking at parasites, fungi, detoxification, dental infections, food allergies, nutrition, the emotional backdrop, and also the medical industry itself in terms of potential contributors to health conditions. So you look at quite a broad number of things in the way that you approach your detective work.
That is correct, because when people come to see me for whether they have MS, Parkinson's, ALS, or cancer, or some unusual conditions, I try to tell my patient, I'm going to make a conscious effort to ignore your diagnosis and ignore your symptoms. Let's look into the underlying problem. I'm relying on meridian system to go to another subtle energy field where the problem might be. So I check for 40 main acupuncture points, and that's been known for thousands of years. So it's not a new information. There are a lot of wisdom associated with the meridian system. We're just exploring the tap into the field to explore the whole that matrix system. And I can pick up those information that people did not address before.
Let's talk a little bit about detox. So detoxification, it seems that we as a society are becoming sicker and sicker. What are some of the main contributors to illness that we're facing today? And are many of our modern problems the result of our toxic environment?
Scott, there's a broad topic, but always look for in kind of layer after layer. So I'm looking at as an infection as a first line I'm trying to get rid of as an infection as a part of the detox. That's one of the fast way to actually rebalancing the meridian system, except dental problem and the allergy immunology point. Now, this allergy immunology point and dental point is not classical Chinese acupuncture point. That was developed by German acupuncturist Dr. Verl. And they always talk about dental and allergy point. And dental is where I see not only the hidden dental materials like amalgam, mercury, cadmium, palladium, nickel, all those environmental toxins, and the infections, especially parasite, people don't think about in the tooth. And in the allergy immunology point, this is what I see now in the allergy problem. I see heavy metal problem, fungal problem, mycotoxins, environmental toxins, and even electromagnetic field. They are very sensitive to the immune system. I can pick up through the signal how they respond.
So do you think then that the terrain is the reason that some of these microbes like parasites then become hosted within us? Is it the toxic environment that we really need to also focus on for long-term health success?
That is correct. So in military analysis, we will be controlling the terrain. Not only you need to know who your enemy is, you have to know about yourself, controlling the terrain. In the military, they rely on night operation, controlling the space, controlling the cybernetic system, and cyber security. So in terms of different biological terrain, I'll be looking for, are you acidic? Are you alkaline? Is your redox potential is out of balance or resistivity? All those parameters as a biological terrain, the controlling, no matter what you do, even if you have a normal perfect pH, even if you have a normal redox potentials, if your resistivity is out of line, then nothing works. Or if your redox is out of balance, perfect pH and resistivity, that your body just doesn't function well.
What are some of your strategies for dealing with the body burden of environmental toxins and shifting that terrain that we just talked about in the direction of health? Do you use things like coffee enemas or colonics, liver gallbladder flushes, or oil pulling in your practice?
Oh, absolutely. Based on what the meridian showing, I will go through the sequence. And the oil pulling, because I see dental problem all the time as a part of the, as a pulling the toxins from your oral cavity. But they only get to the superficial level. If you have a cavitation, the oil pulling is just not good enough. Your bowel have to move. So I always put on some kind of intestinal cleansing to make sure you have a 1 or 2 bowel movements a day. And then you teach them how to do gallbladder liver flush, especially those people who are going through the parasite fungal cleansing. I go through the cycle of gallbladder, liver flush. And some of those people are highly motivated, or somebody who is really sick, make them to do coffee enema daily.
Excellent. Many different types of chronic illnesses, chronic fatigue syndrome, fibromyalgia, Lyme disease, MS, Parkinson's, so many of these where parasites potentially play a role. Do you find that parasites do play a role in essentially all of those chronic illnesses? And if so, how much benefit do people get from treating the parasites in terms of recovering health?
I think most people with all those chronic illness, whether it's a Lyme or neurologic disorder or cancer, I see at least 90% of the time or more have a parasite problem and dental problem. So, Scott, I never separate dental and parasite. It's a continual spectrum of the whole process. So, personally, I don't separate them out, but I see it all the time. So, my recurrent theme is always looking for the infection. And if you treat one but not the other one, you just cannot break that cycle.
What are some of the symptoms that you might commonly see with parasitic infestations? And I know people oftentimes think a lot about physical symptoms, but is there a portion of psychiatric presentations or symptoms that can also be associated to parasites?
Right. I wrote a few articles on that called Parasite and Mind Control, Parasite and Mental Illness. A lot we think is psychiatric medications turn out to have some anti-parasitic activity. That's kind of an interesting, phenomenon. It was written by a doctor, I believe, Torres. I forgot his name, but anyway. So yes, I just had a patient, nun, just so today, and she got these chronic bronchial symptoms and cough, and I put on parasite medication because her large intestinal meridian and lung meridian was out of balance. But she took only about 3 days and she got scared because she got exacerbation of her bronchial symptoms and get short-winded. Go to the emergency room, chest x-ray, they give her steroid, antibiotics, and it doesn't get any better, getting worse. And I saw again, same problem, large intestine and lung. And I was telling her, parasite would have a reaction to control her mind, not to take the medications. Is parasite medication not good for you, controlling your mind? So she got it this time. She says, how tough it is going to be. She's going to finish the parasite medication, and I think she's going to do very well. I've seen many these bronchial symptoms goes away when you take the parasite medication.
Many people think of parasites as primarily a gastrointestinal issue, but isn't it true that most parasites in the body actually live outside of the GI tract?
That is correct. That's one of the major misnomer, because parasites will migrate. They love to go to the lung, to the liver, pancreas, spleen, even to the brain, eyes. I have a patient with going blind, with losing eyesight. They can see parasite in the eye, and losing eyesight every week. Told her by the ophthalmologist to apply for Social Security for blind. I saw as an emergency base from Iowa, put on triple parasite medication, and she gained her eyesight back.
Wow.
Just think about the parasite in the eye.
Wow. Are you more concerned generally with the smaller protozoan parasites or the larger parasites like the worms and helminths or nematodes? How important are these in the work that you do with patients?
Actually, I do not separate out. That's the thing. That's make it sometimes hard to believe by my colleague, because I go through the meridian testing. Usually large intestine, small intestine is usually large worms like a tapeworm, nematode. And if I'm picking up the signal in the liver, gallbladder, pancreas, that can be liver flux, pancreatic flux, or maybe nematode, or possibly protozoa. If it is the brain, it can be anything. It can be actually, flux, tapeworm, nematode, or even protozoal infections. So I'll go through the meridian testing, what kind of parasite we're dealing with. And one other thing is, I'm not really interested in naming the name of the parasite. we have a fixation. We have to have a naming the what kind of parasite to treat. But for me, I'm relying on the Meridian system, and we know what parasite medication does what. So I'm reverse engineering pharmacologist information. So if the Meridian testing respond at go about the Meridian with the praziquantel and albendazole, then I'm dealing with maybe tapeworm and flukes, or maybe a nematode. If they respond to Alenia or tinidazole, maybe I'm dealing with a protozoa. I have some idea of what kind of parasite I'm dealing with, but not trying to naming the name of the parasite. That's not important for me.
Some people would argue that not all parasites are bad, like concentrating heavy metals or maintaining the balance of Th1 and Th2 in the body. Some people even use helminthic therapies to address autoimmune diseases. Do we all have some degree of parasites, and how do we know when we really need to get rid of them?
Right, by definition, parasite is a technical advantage of you. But there is also, like Dr. Weinstock from Iowa, now he's in Boston, in, I think, Tufts University, and he's using this pig whipworm to reduce these colitis. That's another way to do it. But for me, I like to get rid of the parasite. And by definition, parasite is not something you want to keep it. So people less in India, maybe more so in the United States, are more prone to have a parasite problem. But their diet make it adapt to dealing with a parasite, so they can coexist with parasite with those spice food they eat. But when they come to the United States and eating less classical, their traditional cuisine, by eating more American food, they become symptomatic. And they go back to India, eating their own Indian food, the symptom kind of dissipate again. So it's not just a parasite, the kind of a diet we eat. And in America, we don't have that kind of a diet to counteract the actual parasite and still coexist.
Do you feel that parasites can be effectively treated with natural options, herbal options? Do you feel that the pharmaceuticals like Alinea, ivermectin are critical, or do you use a combination of the two? And do we ever fully eradicate them, or are we essentially reducing them and then letting the immune system manage them over time?
Right. Ideally, I would love to choose just a natural remedies. But what I learned from this Bolivia is that there's another quantum level. This parasite has been evolving much faster than we can evolve, what the nature can evolve. So they become synthetic cyborg. They require synthetic drugs to kill them. That's how I look at things. I still use natural parasite remedies to support my patients, especially during the maintenance phase. So I still recommend people to use natural parasite remedies as a part of the maintenance therapy. But by the time people have a cancer, MS, ARS, I don't have time to use natural remedies alone. It may take 6 months, a year to eradicate them. I need to move quick and fast.
The topic of ropeworm is a common discussion over the past several years. Some think of it as a parasite, others a biofilm community. People definitely see something coming out. I'm curious, what are your latest thoughts on ropeworms?
I talked to some of the parasitologists about that. Dr. Volinsky from Russia talked about this ropeworm. They said there are some DNA. I think there's all different combination of a microorganism. I don't think it's a unique, true parasite. So I tell my patient, it may not be, maybe it's unknown, but I'll go through the Meridian testing, and I go through the cleansing, and all those mucus come out, and some people think it's a ropeworm, but I don't argue with my patient. I just say we're going to go through all the cleansing until we can balance the Meridian system.
Let's talk a little bit about fungi and yeast. So fungi can be yeast, they can be molds. In your exploration of fungi, is there a connection between fungal colonization of the body with organisms such as Aspergillus and exposure to water-damaged environments of the home, the workplace, the school, how much of a role does our environment around us play in terms of the fungal organisms within us?
First of all, fungus with us. So it's almost impossible. We all have some degree of a fungal exposure to it and mycotoxin. So when you go to like a fungal conference or environmental medicine focusing on mold and fungal mycotoxin, they spend way too much time on moldy environment with a water damaged roof and basement as a major source. So when they measure mycotoxin, like okra toxin and different fungal toxins, I raise my hand and says, can you tell the difference between that mycotoxin coming from your own internal body or from the environment from the outside? There's no way you can differentiate that whether it's coming from the moldy environment or from your internal diet. Your body have this fungus growing in your gut and rest of your body. And the fungus have a dimorphic, they have two different life forms, either as a yeast or as a mold and as a candida. And if you treat for as a yeast, with let's say nystatin or fluconazole, they'll turn into mold. They require to change a different life form. So you have to go after them with the itraconazole. So after a while, I realized that to hit them hard, I have to use nystatin, fluconazole, and itraconazole at the same time. Otherwise, you're going to change the form.
Wow, very
interesting. And my observation has been, I'm looking from evolution point of view. We have a virus, we have a bacteria, and then we have a protozoa, fungi, and parasite. So if you use antibiotics to get rid of the bacterial infections, it creates evolution more into the fungal phase. But if you start with a parasite, they're at the top of the food chain, they will downregulate to fungus. So after a while, I go through the parasite cleansing, I go through the fungus. Then you get rid of the fungus, then you go into the bacterial phase. So I rather go from the top of the chain, there's a parasite first, fungus, and any other protozoal parasite problem.
When you're exploring urinary mycotoxins, do you do urinary mycotoxin testing, or do you find that the information around mold, fungus, yeast, mycotoxins, that you can get that from your Acupuncture Meridian Assessment toolbox?
Actually, I do both. In the Meridian testing, I usually pick up the signal through the Allergy Immunology point. This is what I pick up: heavy metal, fungal problem, or environmental toxin. So I test them. So if they respond to, let's say the normal reading is at 50, and the Allergy Immunology point is at 25, and then if I use nystatin, minimum response. If I use DMPS, minimum response. But if I test, let's say, different combination, let's say I use nystatin and fluconazole, the reading go back to about almost normal at 45. If I combine three combinations, itraconazole, fluconazole, and nystatin will go to 50, then I know we're dealing with a really serious fungal problem. And I usually recommend get the mycotoxin level, but I don't push to do it. It's just, I'll treat them, but if you know what we are dealing with, it will be easier. Then I can deal with give a binder, like a cholestyramine, charcoal, and all those other binders, but I don't initiating until I have identified what kind of a mycotoxin we may be dealing with.
Do you find that when there is colonization, that this is a scenario where you also generally tend to need pharmaceutical interventions, or can some of the natural tools fully address these issues?
It depends on the degree of the problem. I'm an internist, I'm a medical doctor, I'm used to using medication. I always still use some antifungal natural remedies. I don't want to mention different name, specific company, but oregano oil is another good example to use as part of the antifungal remedies. But I never use one particular brand alone. I usually use a different combination to rebalance the meridian system. And the parasite and fungus seem to have a symbiotic relationship to protect each other. So fungus may create a matrix to protect some of those parasites. So after a while, I realized that I have to go through the fungal cleansing and then go through the parasite, go to the multiple layer to get to the root of your problem.
Let's talk a little bit about cancer. So from your perspective, what are some of the key reasons that so many people today are dealing with various cancers?
That's a little bit touchy issue. I have to be careful what I'm saying, but I just published a paper about using anti-parasitic medications and antifungal medications with a great success for treating cancer patients. I believe cancer is a metabolic disease. The Dr. Warburg talks about it. Thomas Seyfried published his book on metabolic disease as a cancer is a metabolic disease. But also, I think cancer have all the characteristics of a metabolic parasite. And there's a dramatic response to antifungal and antiparasitic medication, and with all those environmental toxins we're dealing with. So by the time I have a cancer patient, it will be like this. I just saw a lady from Hawaii. She got third recurrent breast cancer. She already have a chemo. She didn't do the radiation. She had a lumpectomy. Third time, she's scared. If you don't correct the underlying problem, the cancer will always come back. When I check her, she got the root canal going through the breast meridian. She got heavy dose of environmental toxins. She got extremely high mercury. All those environmental toxins, the pesticide, insecticide, that create an environment for cancer to grow. So we have to address them all to give a best chance that the cancer will not come back. My book talks about many different cases of dealing with, and never dealing with going after the tumor itself. It's always removing the underlying problem.
I know that ivermectin is a medication commonly used for parasites and also can help in some cancers. Is the mechanism that ivermectin may be helpful in cancer, do you think it's the result of addressing parasites, or is there another mechanism where ivermectin might be helpful in cancer?
Yeah, I think it's playing dual function. It may be specifically for parasite problem, but it also affects on PAK1 kinase that's needed for most of the 70% of the tumor to grow as a part of the enzyme. So you have a secondary beneficial effects. So we really cannot differentiate one from the other, because I'm looking at tumor as a parasite, and they also need PAK1 kinase for tumor to grow. So we're hitting them both with the ivermectin.
Let's talk a little bit about dental issues. I know several different threats fall into the dental realm: amalgams, root canals, cavitations, bite issues even. Talk to us about root canals, why they're an issue, are they always an issue, and how they impact the meridians and then potentially other organs and systems in the body.
The danger of the root canal has been known for over 70, 80 years with Dr. Weston Price. And also Dr. George Manick wrote a book, Root Canal Cover-Up. There's compelling evidence. But when you're looking at the X-ray, most of the time it looks fine. They say it looks fine. But energetically, I pick up always a dental problem. And, I'm giving a talk to usually a dentist, biological dentist, and sometimes it looks perfectly normal looking dental X-ray, but I pick up energetically where the hidden problem might be. So let's say example will be number 10, a tooth is bad. Look at the X-ray, looks fine. So dentist will do cone beam 3D CT scan, looks fine. Maybe do muscle test, looks fine. But I'm getting into this subtle energy field through the meridian system, and I'll challenge the patient's body, and I say it all the time. So my message to the dentist is, X-ray, even CT scan, cone beam scan is not sensitive enough. You need to have at least 10%, 15% bone damage before you will show in the 3D cone beam scan. But before that, there is a toxic effect, energetic disturbance that I can pick up through the meridian testing.
Let's talk then a little bit about cavitations. How often do you find cavitations in people? Are they a problem only in those that are chronically ill, or do many asymptomatic, healthy people also have cavitations that might then set the stage for a later health challenge?
Right. People can have a cavitation for 20 years if you're overall in good health. The cavitation might be from wisdom tooth that was extracted when they're 18 years old. At 40 years old, they're doing fine. And then they have a, let's say, minor car accident, some sports injury. And all of a sudden, they have all symptoms are coming up. And when you trace back, that was actually from the wisdom tooth extraction that was done 20 years ago. So they can handle up to so many years, and then they will start showing up subtle signs, and then they remember, well, it must be the car accident, maybe it was a sports injury, maybe they fell, but no, that's only the tip of the iceberg. Like it's a what we call hairpin that breaking the what we call needle sac, looking at the problems. So anyway.
What is the biggest barrier that you face with patients in terms of following up on your recommendations for extensive dental work? How do you address the stigma around tooth loss in terms of being a sign of failure and aging versus progress and a return to optimal health?
My dental advice is one of the most difficult part, and this is where I lose my patient the most because they don't want to deal with it. When they find out how much it costs to undo the whole things, when they spend $30,000 or $50,000, I tell them, do it over again, undo it. Many of them do not come back to see me again, but they may come back 5 years later, they still have the same problem, and sometimes it's too late. So saying that, I educate my patient and get to the main problem, get the infection out first, before you do bridge work to be done or any amalgam to be out. Although I'm totally against silver fillings with the mercury in it, to me the infection is the driving force. Toxin is a gradual. Even there for 20 years, I can wait for 6 months or a year. But infection, I want to get them out as soon as we can.
Let's talk now a little bit about the allergy immunology piece. So the contribution of immune hyperactivation or allergies to many substances is often overlooked. If the immune system is responding unnecessarily to many different environmental exposures to foods, these essentially burden the immune system. They create inflammation, which makes everything worse. So what do you see as the key allergens that impact your patients?
First, from diet, and I see I do allergy tests as part of the routine. The most common one is probably well known: wheat, gluten, corn, soy. Many of them are GMO, genetically modified organism anyway. Dairy I see all the time. And time to time I will see broccoli, garlic, asparagus, tomatoes, and sometimes, big surprise, like many fish, chicken, eggs, it's there. But people just don't know it because the test ID is called delayed response, IgG delayed response, and they don't have the classic allergic response, and they still become chronic inflammation eating those food. And so I look at it as part of the routine. I check for everybody.
How much of allergy is driven by parasites, meaning that the immune system is shifted to a more Th2 dominant state as a result of the parasites, and that as the parasites are treated, that allows then the body to shift back towards Th1 to have less allergy and autoimmunity, and also then to deal with other chronic infections. So does treating parasites also help to minimize the allergy issue?
Right. Actually, that's a good question because depends on the stage of this parasite infestation. I explain to my patient, when patient, like a cancer patient who is at the end stage of cancer, sometimes I suspect allergy problem, but the allergy test comes blank. It's a big surprise. It's like nothing shows. The reason is the immune system is so run down state, they cannot even produce normal allergic response. As they get better with the cleansing and detox, 2 years later, we may see the actual allergic response. So it's also phase dependent. So sometimes I expect allergy problem, but I don't. And those people, maybe they're lucky they don't have an allergy problem. But many times those are actually very sick people that cannot even produce normal allergic response. So I tell my patient, you didn't waste your money on allergy tests. Your system is so run down state, you don't even produce a normal expected allergic response. Does that make sense to you?
Yeah, absolutely.
Mhm.
So extending then on the allergy discussion, mast cell activation syndrome and histamine intolerance, those have become big topics over the past few years. Do you think that parasites and mold or fungi are triggers for mast cell activation syndrome? And does that syndrome reduce with your approach to addressing parasites and fungal issues?
Yeah, I don't really see too many called mast cell syndrome classical case. I've been reading about it, but I really strongly feel that this missing link is a parasite problem and probably some degree of fungal problem. The problem with the parasite is that there's no reliable way to check for parasite. That's the problem. So we describe it as mast cell syndrome, just like we naming the name Lyme, mast cell syndrome, whatever the diagnosis is. But underneath, I see hidden parasite problem, fungal problems, and hidden dental infection. There are many different microorganisms, including protozoal infection.
So let's talk, you mentioned Lyme. So let's talk a little about Lyme. Many people listening to this show having had chronic Lyme disease. I'd be interested in your thoughts around Lyme, how much of a role it plays in burdening the body and leading to chronic health challenges. I know that you believe it is a real condition, but how much of a factor does Lyme play in burdening the body when someone's also dealing with parasites and dental issues and toxicity issues and food allergies and so on?
First of all, I think Lyme is a little bit confusing. By classical definition, Lyme should be, the way I understand, is a CDC criteria, which is a Borrelia burgdorferi infection. And people often respond fairly well to that alone for Borrelia burgdorferi with the antibiotics. But there are many Lyme-like symptoms. That's what I call pseudo-Lyme. They mimic exactly like Lyme, and they don't respond, or temporary response, and they plateau and they progress again. I have a patient who's been on IV antibiotics for 10 years, feeling better, functioning better, but still all the symptoms never been gone. They have a parasite problem. They have a residual dental infection as a cavitation. So until they get rid of the parasite and dental problem, they still have this what I call low, lingering, chronic, what we call persistent post-Lyme like symptoms. So I try not to dwell on that diagnosis itself as a Lyme, unless there are many things have a mimicking just like a Lyme. So dental infection, the treponema, is so basically spirochete, they behave very much like a Lyme, and you cannot distinguish that. So if I give you one example, it will be like this, Scott. About a husband and wife came, 65-year-old female and man. The wife was diagnosed with a Lyme, with all those symptoms of a chronic fatigue, fibromyalgia, all those neurologic symptoms. Isogenic Lyme test negative for IgG and IgM. Her husband positive for IgG and IgM, Lyme test positive, absolutely asymptomatic. What's the difference between those two? Wife had 6 root canals. That's the only difference. And there's a mental block to remove the root canals. They don't want to lose their tooth. They went through all the Lyme special clinic, now in the United States, went to Europe, and just came back. He said, feeling somewhat better with all those IV laser therapy, but it will not treat those root canals. They will mimic just like a Lyme by treponema denticola.
Yeah, and that's an interesting thing too, because you wonder then if the root canals potentially were suppressing the immune system such that her IGeneX test, to your earlier comment, she couldn't mount a response where her husband's body wasn't burdened, and thus he was able to show a positive IGeneX test.
Absolutely. You can, argue either way, but the fact is the dental is a driving force from one mimicking just, she may not have a Lyme, but mimic just like a Lyme-like symptoms.
Mm-hmm. Let's talk a little about viruses. So lots of different chronic viruses that we know can play a role in health, even some cancers as well. Do you find that viruses need to be specifically targeted in a treatment protocol, or does unburdening the body from parasites and fungal issues, dental issues, toxins, allergens, does that allow the immune system then to come back online and address the viral layer?
I'm looking at virus as a part of it is encoded in our DNA and in our RNA. And so I'm looking at from evolution of the biology. We have a DNA, RNA, and then we have a protozoa, bacteria, fungus, and the parasite. So when you get rid of the parasite, often they release also fungal, bacterial, and viral particles, and you're shedding the viral burden. So if you look at, let's say, Lyme patient, they have you can say FSMB virus positive, CMV virus positive, all those different viral titles positive. But today actually causing the symptoms, or maybe they overlook the actual bacterial, fungal, and parasite problem and dental infections. From my perspective, we should not focus on virus. We should focus at the higher level. That's the parasite, protozoa, fungus, etc. And there's a bacteria. There's many different spectrum of the bacteria. They're like a fungal-like mycobacterium, actinomyces. All those different spectrum of the bacteria, they're like a hybrid. Some are like a protozoa, some are like a fungus. It's a very complex issue, and we don't have to naming the name, but that's what we need. Sometimes big gun, and sometimes I have to use IV therapy, UV, ozone, I do insulin potentiation therapy using antiviral, antibacterial, antifungal, antiprotozoal, and antiparasitic medication as a part of the therapy.
We as humans are more than a physical body, but also an energy body, an electromagnetic body. You talked earlier about EMFs. What role do the exogenous EMFs from cell towers, Wi-Fi, cell phones, and other sources play in terms of bringing down our health? And then how do you address when people are sensitive to the electromagnetic environment around them?
I wish I can give you any like a clear answers, but I don't. I'm still looking for the answer for myself, for my patients. But I usually pick up the signal through the allergy immunology point. And especially those people with the heavy metals are highly sensitive to EMF. If you have a lead, mercury, high copper, it's really, you don't have to think about it, it makes sense. I can do simple tests, hand-to-hand conductance tests, and often this score gets higher and higher because we get exposed to all those environmental heavy metals, and we conduct electrical current at a faster rate than without those extra heavy metals. Some of those patients have a hard time get rid of this parasite, and fungus are also those people are sensitive to EMF. I see the correlation. I don't have enough experience what kind of device might be beneficial. There are many, like some kind of a cage to protect your body, all those devices. They may protect to some frequency, but not whole spectrum of the frequency. So if you ask me, I don't have clear answers except go detox, especially heavy metals should come out. Once you have a parasite and fungal problem, it's like a vicious cycle. They become more sensitive to EMF. The EMF makes it more difficult to get rid of fungal and parasite problem.
What are some of the patterns that you see in children on the autism spectrum in terms of the factors contributing to their condition? What do you see as the key issues involved in autism?
Man, you keep asking me all these questions. Scott, it's a kind of a politically sensitive issue. I'll just tell you from my experience. It's just one example. I have a 35-year-old nurse from Dallas came to see me diagnosed with Lyme, the chronic fatigue, fibromyalgia, and all with neuropathy, neurologic symptoms. I checked. I think she got like a 9 out of 40. Meridian was out of balance. I put on 3 different parasite medication. And she felt so much better. She didn't tell me she had a 5-year-old autistic child, severe autistic child with an ATEX score of 109. I don't know what does it mean, except she told me that means a severe spectrum of autism. He's not talking, he's not communicating. And the mom she's a nurse actually, and gave her medication to her 5-year-old child without letting me know. And within few weeks, he was able to start talking. And she couldn't believe it is possible, but she was so desperate for a child, gave her parasite medication to him. So when she came back, I have to pretend I'm very upset with her, and that you cannot do that without even discussing with me. But at least let me see your case. Anything else is going on? I check. You need different kind of parasite medication also, like you need for antiprotozoal, which she didn't get that kind of medications. And I check for heavy metals, and his heavy metal, the mercury level was twice high as his mom. I mean, she have a very high mercury level, but he's actually twice as high, and he's only 5 years old. That means she was passing, it's a transgenerational, passing the mercury from her to him. So what caused autism? I don't know. She said it was a vaccination, maybe triggering it. Maybe within the vaccination may have a mercury in it, and he has a mercury in it that triggering the sort of autoimmune response and with a parasite problem. But it's just a one case. It doesn't mean everybody will respond to parasite medication. So there's a problem with the autism community is that they're so desperate, trying to do anything, and sometimes it doesn't work at all.
Right. I know that you've worked with people with ALS as well. What have you learned from your work with ALS patients?
Same as all those things I've been talking about. I'll give you one example. It will be like this. I have a patient, 67-year-old man, came to see me, recently diagnosed with ALS. And when I check, he's got dental problem, he's got parasite problem, he's got fungal problem, heavy metal problem, hormonal problem, low testosterone. So I'm eliminating as much as I can. I'm racing against time. So the faster I can apply all those things. One of the biggest problems I face is always the dental. And not only they're resistant to it, if I took care of one kind of dental problem, another dental problem shows up. And then when you're taking care of it, another dental problem is showing up. So this is a process you have to go through it, but as fast as you can. We went through about 18 months to almost 2 years. And he went back to the neurologist, and they couldn't believe that he's still functioning very well. And finally, almost 2 years later, they're saying, we made a mistake. I don't think you have an ALS. And he wrote a book, and his name is Ron Antorino. It's called Unexpected Journey. And he wrote the whole process why I have to go through it. Additional treatment on him was as an exercise program. He had to crawl. I have to tell him he had to crawl at least 15 to 20 minutes twice a day, racing with his grandkid who can crawl faster. I did microcurrent therapy. I put him on insulin potentiation therapy with antiviral, antibacterial, antifungal, antiprotozoal, all those infectious burden. And he got better. And I see all those ALS patients have another ALS patient is an architect. And within 3 months, he was in a wheelchair before I can do anything. And when I check environmental toxins, got massive amounts of petrochemical toxins. 6 months later, I started picking up the environmental toxin in the allergy point. Check again. This time, he's got organophosphate. That's a pesticide, insecticide showing up massive amounts. When he did a literature review, they're saying this organophosphate poisoning can mimic exactly like ALS. So we sent to the university to do something about this organophosphate. And you know what? They don't know what to do with the information. They really don't. So we're doing all we can, IV therapy, IV phosphatidylcholine, UV, everything we can to stabilize him. but it will take some time for him to recover from this. Did I answer your question?
Yeah, you did. Definitely the differences between all of these different conditions. SIBO and SIFO are commonly discussed now more than ever in terms of GI conditions that people are dealing with. We also know about Crohn's, ulcerative colitis, IBD, IBS. Would you say that the majority of those conditions also commonly have a parasite component?
I believe so. I mean, they don't always respond. I think there are some emotional components to it and the GI problem, but yeah, many people do get better, yes. And using different combination of the antiparasitic and antifungal medication. By the way, I don't differentiate between SIBO and CIF or the fungal aspects. It's a whole spectrum of the continual problem.
Right. Morgellons is another condition that people often don't really understand the root cause. Have you worked with any Morgellons patients, and have you been able to lead them to higher ground?
I have a few cases I can talk about. I have one Boeing engineer who is working on a black box project, and he always talk about these fibers coming out of his body, but I don't pay attention to his actual symptoms. He say he's got Morgellons, and when I check, he's got significant parasite infestation and dental problem. Going through the process, he said he felt 90%, 95% better, and that was good enough for him. So, and I see a few people like that, they say they got Morgellons, and they often have a parasite and dental problem.
Very interesting. I personally am very excited about frequency-specific microcurrent, or FSM. I know you use that in your practice as well. What kinds of things do your patients find frequency-specific microcurrent helpful for?
I don't use as much as I should because time-consuming part of the aspects of it. And but I think it's good for me as a general support, not as what Carolyn McMakin is using for. These people really spend every day feel for every known muscles and tendons, but for us it's just general support to reduce the inflammation and for general pain, but not exactly what she's designed for. So I'm using only less than 5% of the potential use for FSM.
In one of your recent articles, you wrote about your own personal experience with palladium poisoning, which is a heavy metal. Did you identify your palladium exposure, and how's your health now that you've been working on chelating?
Yeah, it's another big mystery for me, myself. I really have no idea. I can easily blaming government, maybe military, experience, maybe where got that from. Maybe I can look for maybe, I don't know, Russians. My wife says she is innocent. And, it's like this. I see people always, I ask them, where did you get your tungsten? Where did you get the cadmium? Where did you get the tin? Just like me, I have no idea what I got exposed to it. But from my experience dealing with a few patients I dealt with, they all developed cancer. So I did check for actually cancer profile, and I was becoming high risk for developing cancer. So I'm treating myself as a cancer patient. What precancerous condition be proactive. And I did IPT for myself, the insulin potentiation therapy using antiviral, antibacterial, antifungal, antiparasitics, and going through all this different therapy, aggressive chelation therapy. DMPS and EDTA, they all pull palladium. I think DMPS a little bit superior to EDTA. It's going to be more and more difficult to use DMPS. It's not available. It's too expensive. But luckily, I can use EDTA to pull palladium out. And my palladium level peak at 500. Anything above 0.3 is considered high. Anything above 1 is considered too high, and my level is not dropping down to about 200 from 500. And I'm doing what I can. I do neurofeedback. There's the study shows, animal model and human model. When you have a poisoning, you can give a neurofeedback called SMR. sensory motor rhythm at a low beta frequency, and they can tolerate the toxin much better than without any neurofeedback. So I do that as part of my therapy so I can tolerate the toxic effects of the palladium. Trying to beat the odds, you know.
Well, I'm happy that you have this knowledge to be able to address this issue, because you certainly are important to many of us. What is the experience of coming to prevention and healing in St. Louis for a new patient? What can they expect when they visit your office? And what are some of the tools that you might utilize to arrive at your diagnosis and treatment plan?
Now, first of all, I tell my patient whatever their diagnosis is and symptoms, they have to be open-minded about what I'm going to find. Some people have a fixation. I got parasite problem, and sometimes I just don't see it. The only thing I see is a dental problem, allergy problem, and they get very upset because they have a fixation with a parasite problem. So whatever their problem is, I'm looking at always the underlying problems. Typically, I do all my patient hair sample to be analyzed for mineral compositions. I do basic allergy tests, looking for any unexpected food allergy problem, or sometimes I look for airborne allergy problems. And it depends on the meridian testing. I'll be looking for heavy metals, environmental toxins, parasite, fungal problem, all those, and we'll go through the process. So people are coming from out of town or out of state. I end up doing maybe 2-3 extra steps because they can afford to come back and forth. And I tell my patient, do not expect 1 round or 2 rounds of a parasite medication or taking care of your problem. If you have this problem for 10, 20 years, you take care of one kind of a parasite problem and another type of parasite will rise. When you're taking care of that, it might be a fungal problem will show up, and then another parasite will show up, dental problem will show up. It's a process. So usually I discourage people from another country expecting one visit will taking care of it. Luckily, St. Louis in the middle of the United States is usually 1/2 of most people. And yeah, you know, I just tell people you have a realistic expectation.
So talk to us about your latest book and where people can find it, Accidental Blow Up in Medicine, just out in the last several weeks. I have had the opportunity to read it. I think it's a fantastic resource. I think for both patients and practitioners, and I know there's a section in the back for practitioners as well where you outline some of your parasite protocols, which will be very helpful. Tell us a little bit about the book and where people can get it.
You know, this is my second book. First book is called AcciDental Here, and I feel like it was a little bit incomplete because I was afraid to say some of the extra informations. Now, after 10 years later, I feel like I need to reveal some of the actual parasite medication I use, and what are the most common doses I use, and different combinations. And it's kind of evolving because now I cannot use ivermectin. I cannot use levamisole, so I have to always substitute one medication to another medication because the FDA don't like certain medication to be available to for human consumption. So I have to always looking for substitute for one medication I've been using for 5 years or 10 years. I have to change to something else. Like a cancer patient, I usually use different combinations of a parasite medication, including levamisole. And the FDA agent came challenging me why I'm using it. It's not available for human consumption, and shut it down all those pharmacies I was using. So I have to use now change to niclosamide, and it works almost as good as a levamisole for cancer patients. So it's kind of evolving, and I wrote about the whole story behind it. And the next book is about, second book is about AcciDental, but if you see the book title, it says dental is highlighted, about the dental connection. Why the dental is the turning point. I tell my patient, I'll do my best to clean out as best as I can, parasite, fungal, environmental toxin, but the miracle doesn't happen in my practice. Miracle happens in the dental chip if it is done correctly. So we need that biological dentists to work together. think I covered all the bases, right? Is that what you asked me?
Yeah, so if people are interested in getting the book, they can get it at Amazon.com. They can also get it at preventionandhealing.com. So it is readily available. And I definitely urge people to check it out. There's a lot of great information in there. The last question is one that I ask all of my guests, and that is, what are some of the key things that you do on a daily basis in support of your own health?
Well, I do routine yoga exercise with a little bit of a lightweight. I used to do sprinting as a part of my exercise program, but after the palladium, the high in phosphorhexoisomerase, I stopped doing some of the intense exercise until I get my palladium out. I do coffee enema as best as I can if I have time to do it. And I guess the important part is I do my morning prayer and meditation. Start with the positive, to start with always gratitude as a means to, I can do something for my patients, not just for me, but for other people. That's kind of motivating factor, get me through the day.
Beautiful. This has been a fantastic conversation. I certainly honor you and value your work. I personally, for those listening, have worked with Dr. Yu several years ago, and at that time we did identify a parasite issue. He was the one that identified my cavitation issues, which were addressed about 6 years ago now. And so his medical detective work is something that I've personally benefited from. I urge everyone to check out the book, to check out his work at preventionandhealing.com. And I just thank you so much, Dr. Yu, for all of your contributions to making life better for so many of us.
Well, thank you, Scott. Thank you for the invitation.
To learn more about today's guest, visit preventionandhealing.com. That's preventionandhealing.com. preventionandhealing.com. Thanks for your interest in today's show. If you'd like to follow me on Facebook or Twitter, you can find me there as Better Health Guy. To support the show, please visit betterhealthguy.com/donate. If you'd like to be added to my newsletter, visit betterhealthguy.com/newsletters. And this and other shows can be found on YouTube, iTunes, Google Play, Stitcher, and Spotify.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.